Improving HBV Screening Before Switching to Two-Drug HIV Regimens, by Gina Shaw, Implementation of a Best Practice Alert, BPA, in the Electronic Health Record, EHR, led to a significant decrease in switches to two-drug antiretroviral therapy, ART, among HIV patients with hepatitis B virus, HBV, coinfection, reported researchers from the Icahn School of Medicine at Mount Sinai, in New York City, during a session at IDWeek 2024, held in Los Angeles. Approximately 5% to 10% of people with HIV in the United States are also co-infected with HBV. Two-drug regimens are not recommended for patients with chronic HBV infection, but current guidelines do not address their use in those with HBV susceptibility and/or core antibody reactivity. A 2023 case surveillance study at Mount Sinai identified 4 patients with HBV infection or reactivation after a two-drug ART switch, 2 with HBV susceptibility, 1 with core antibody reactivity and 1 with surface antigen reactivity prior to the switch. J. Acquire Immune Defic SYNDR 2023, 94, 2, 160-164. 2 of them ultimately developed fulminant hepatitis, and 1 required a liver transplant, said Melissa Margolis, MD, MSc, a third-year resident in internal medicine at Mount Sinai. This was the impetus for our study, a quality improvement (QI) project. The investigators created a guidance document that recommended HBV surface antigen, HBsAg, core antibody, HBsAg, and surface antibody, HBsAg, testing at a minimum of 6 months prior to a two-drug switch. For those who were surface antigen positive, we recommended that they not be switched to a two-drug regimen and that they continue or start HBV active ART, Dr. Margolis said. For patients who were surface antigen negative, the serology from core antibody and surface antibody determined the next steps. Patients who were HBsAg positive and HBcAg negative were deemed vaccination immune and could switch to a two-drug regimen. That guidance was incorporated into a BPA associated with 3 two-drug HIV regimens: dolutegravir rilpivirine, Juluca, GSK, dolutegravir lamivudine, Dovato, 7V Healthcare, and intramuscular cabotegravir rilpivirine, Cabenuva, 7V. The alert went live in the Mount Sinai EHR on February 1, 2023. The study examined retrospective data from the year prior to the intervention, and compared it with data from February 2023 to February 2024. The 2 primary objectives were to increase the percentage of patients screened for HBV, SAG, CAB, SAB, within 1 year prior to a two-drug regimen switch, and to decrease the number of switches among a composite group that included those with HBV infection, SAG, and isolated CAB, the intermediate risk category. The study population included 306 patients, 161 from the pre-intervention period and 145 from the post-intervention period. Incorporation of the BPA into the EHR led to a significant increase in screening for HBV, with 71% of patients receiving complete serology within 1 year prior to a switch, compared with just 30% before the alert was implemented. In the composite group, the group we are most worried about for reactivation events as well as infections, we also saw a significant decrease in the number of switches in the post-intervention period, Dr. Margolis said. Prior to implementing the alert, 12 patients in that group were switched to a two-drug regimen, while post-intervention, only 1 surface antigen positive individual was switched. Given the rising popularity of two-drug regimens and the new antiretrovirals in the pipeline, HBV screening in people with HIV becomes increasingly important, Dr. Margolis said. Through a simple QI-BPA alert, we were able to increase the percentage of those screened, as well as decrease the number of two-drug regimens among those most likely to be at increased risk for HBV-related events.